Welcome to our Axios Vitals virtual event on addressing mental health and well-being in the healthcare workforce. I'm Maya Goldman, healthcare policy reporter for Axios Pro, and I'm coming to you today from Washington, D.C. Welcome to our audiences on Facebook, YouTube, Twitter, LinkedIn, and on Axios.com. You can join the conversation today on Twitter with @Axios and hashtag Axios Events. Over the next 30 minutes, I'll be joined by my colleague Tina Reed, and we'll examine ways to address burnout and improve employee well-being in the healthcare industry. Our first guest is the Congresswoman from Virginia's 2nd Congressional District, Jen Kiggans, joining us today from Virginia Beach. Welcome, Congresswoman.
Thank you very much for having me on today.
We're so glad to have you here. So you yourself are a nurse. Can you talk about your background in the field and how that informs your work as a legislator?
Yeah, so I'm actually an adult geriatric primary care nurse practitioner. That's what I'm certified as. And I was a nurse, I got my RN, BSN, and then went to a master's program to become an adult geriatric nurse practitioner. And I've had the opportunity to practice in many fields that deal with older adults, long-term care, assisted living. I've done some time in memory clinics, in memory care, and most recently in primary care, which I love, and also rehab. Loved that as well. But and did some home health and hospice time too, which was great because I was able to go into people's homes. But it's just been an honor and a privilege to take care of our greatest generation, to partner with them and their families and caregivers to be able to provide for the best healthcare and the best quality of life that they can have in their golden years. And as a legislator, this has helped me on the state level. When I was a state senator, we did a lot of things with nursing home reform. And during COVID, it was so challenging because we were dealing with things like isolation issues and how could we, safely get visitors into facilities and even things like clergy visits. How could we ensure patients had the right to that? And then we've always been working on things like nursing workforce challenges. That was something I did on the state level. And I'm excited to do it again in Congress and have already, begun to do some things with that. But being an advocate for healthcare providers, as well as my patients, as well as their caregivers and families, has just always been a great honor.
Yeah, so as you alluded to, it's no secret that many nurses experience burnout and mental health struggles. It's a very difficult job. And a recent survey from AMN Healthcare found that nearly 1 in 3 nurses said they'll likely leave the profession due to pandemic-induced burnout. So what has gone so wrong? What are the root causes of this, in your opinion?
Yeah. In my opinion, I think, nurses have been really asked to do a lot over the past couple of years, especially during COVID, in circumstances where we didn't really know. There was a lot of unknowns, especially in the beginning. And even when we realized, how we could safely treat COVID patients, it was still a lot, wearing PPE, showing up to work and dealing with patients that were in isolation and dealing with their families and caregivers, and a lot of unanswered questions. So it was challenging for a long time. And I think nurses leave jobs because they're overworked a lot of times. They're tired, right? We've asked so much of them. They're overworked and sometimes they're underpaid. And that's why, I've left jobs in the past. That's why I think a lot of we hear about nurses leaving the workforce now. We need to think about the quality of life for our nursing workforce. What does that look like? Making sure their work environment is safe, making sure there's enough nurses there so that there can be, other people to share the workload with, so that the workload is lighter. Making sure we're just really being mindful of quality of life issues, and pay is important too. But how can we be advocates for them? I think especially now, we're challenged because we don't have as many nurses as we wish we did. People have gotten out since COVID. It was a problem before COVID, but COVID kind of exacerbated the problem. And more nurses, yes, are thinking of retiring or going into nursing jobs that maybe are as educators or that are not direct patient care. So we still need to find ways to incentivize people to go into that profession. It's a wonderful profession. There's nothing more rewarding than providing that level of healthcare, but a lot of different challenges we need to be mindful of to be protective of that workforce.
Yeah. What can Congress do specifically to sort of to alleviate some of these concerns?
Yeah. It has to be a mixture between not just Congress, but there's a lot of work to be done on the state level and different states. And just coming from the state legislature, I can speak to that a little bit. We've seen, especially for advanced practice nurses, implement people like nurse practitioners who have advanced practice degrees to be able to practice to the scope of their degrees and their certifications. That's something we've come a long way in Virginia. We have some avenues for independent practice authority. I'd like to see all 50 states provide those avenues, because there are many nurse practitioners who can practice autonomously and who have lots of experience, sometimes more than the physicians and other healthcare staff. So it would be wonderful to be able to allow them to practice to the full extent of their certifications, especially in some of the challenged areas like rural healthcare. And I think of other places that need healthcare staff right now. Mental health care, we don't have enough mental health care providers to treat the amount of patients that we need to be treating. So I think that's one way for state legislators really to get involved. I think of things like expanding nursing scholarships, and how can we incentivize just financially for young men and women to go into the profession of nursing. As a Navy veteran, I think of how can we incentivize people like our corpsmen and people who may have served in the healthcare profession in places like the military. How can we make that transition easier if and when they decide to get out of the military? If they want to transition to healthcare professions, how can we make that transition easier? How can we work with spouses of military personnel who sometimes move from state to state and make sure that we are, relieving the burdens of transferring licenses and things like that. So I think there's things we can be mindful of state level, working on those same issues on the federal level. But there needs to be, I'd love to see more nurses participating in government so that we can get some of these things done on all those levels.
Yeah, got to recruit some coworkers. You recently introduced legislation on a federal level to remove some of those barriers to advanced practice nursing. Tell us what's in the bill and why you feel that that's important to do on a federal level too.
Yeah, so the ICANN bill that I introduced, which is a bipartisan piece of legislation, really expands that scope that I was talking about and allows nurse practitioners, advanced practice nurses, to practice to the full extent of their certification. So on the federal level, we think of things like ordering diabetic shoes. That's been something that nurse practitioners have been pushing for a while. But signing home health orders, therapy orders for patients that are Medicare and receiving some federal types of health care. It just really expands that scope. Now it takes into in mind the state restrictions. So if you are in a state where autonomous practice isn't authorized yet, then it doesn't supersede the state's laws, but it really just expands what we can do on the federal level for patients that are covered under federal health care.
Yeah. And you're also one of the vice chairs of the newly relaunched Congressional Nursing Caucus. So aside from this bill, what other kinds of policy and legislation does the caucus plan to tackle this Congress?
Yeah, one thing that is important to me, and I can't wait to bring up to my colleagues on the bipartisan nursing caucus, is the challenges that we're facing in mental health care right now, because many, especially politicians, like to talk about mental health care and how we need to be giving better mental health care and have better access to mental health care and treatment. But not a lot of us think about those challenges from the provider side. And that's something that I have worked with, again, on the state level. I mean, we used to get together mental health providers. The only time we could talk was 10 o'clock at night on a group phone call, because everybody was so busy and so working so hard that there was very little time even to get together to hear from them about their challenges, things like reimbursement and insurance coverage. And so what's important to me is being able to advocate for providers. What do they need so that I can make their lives easier, so that they can be properly compensated, so that we can have more of them, and that they can do their jobs and be in places where we need them to be, so that the patients out there who need the mental health care are able to get that. But that's certainly a priority of mine. I can't wait to work with my colleagues on the nursing caucus to make some improvement in.
Yeah, that's an extremely important issue across the board these days. In our last minute here, I'm curious to know what you wish your co-legislators in the House and Senate knew about being a nurse.
Just that, I think we work differently. I think nurses who are legislators are great listeners. Nurses in general are wonderful listeners. We partner with people. We ask people to come to us, and we want to work with you, to solve problems. We're good compromisers. We understand kind of the challenges, of each patient brings, but we really we believe the struggles that our patients have, first and foremost, and then we want to work together. And it's a collaborative, discussion about these are our healthcare goals. What are your challenges? How can I help you meet those challenges? But I think nurses do legislate differently, and I think we need more nurses in government on all levels, city, state, and federal. And it's an honor to be able to now be in Congress and to be able to be a voice for all levels of nurses, from CNAs and LPNs to RNs to bachelor's and master's trained nurses. I just think that there's not enough of us out there, so it's just a great honor to be able to speak for for them and on their behalf.
Well, thank you so much for joining us today, Congresswoman. We are very excited to keep in touch on these issues, and hope we can talk to you again soon.
That would be great. Thanks so much for having me.